If you're struggling to build your family, you've been trying to conceive for a while, or you're having recurrent miscarriage, you may also be struggling with intimacy with your partner. This is common. This is something that a lot of my patients deal with and a lot of people do not talk about. So if you're finding that infertility is ruining your sex life and you want to understand why and what you can do about it, watch this video. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families for over 15 years. And I talk to my patients about a lot of things, not just fertility treatments and testing. We talk about the emotional strain of this process and specifically its impacts on intimacy. This is common, and unfortunately, a lot of people don't talk about it and they can often feel alone. I know this resonates with people. I put a TikTok out recently that got a lot of interest. I was using that CapCut and TikTok collaboration with Mike Wheeler, the character from Stranger Things, where he kind of walks up to the camera and clicks like that, and the scene changes. I'll show the TikTok right here, but basically it was like before he snaps, it's like, before you're trying to conceive, and it's partners that are playful in bed and smiling, and then it's like click. Then infertility, and it's like two people in bed but just facing away from each other. And it really resonated with people because just in a few images I was tapping into something that is really common. So if this topic resonates with you, you are not alone. In this video you are going to learn about why intimacy is so impacted with infertility and fertility treatments. We are going to go through the research and understand the literature, just how common this is. I'm going to end the video with some helpful strategies to help you regain that intimacy with your partner. So let's get started. So what does the literature say? Just how common is this? Well, there's lots of studies out there looking at quality of life, emotional strain, sexual intimacy, and impacts of infertility and different life situations on intimacy between a couple. Several of them show just how common this is. In this study published in 2019, 113 couples undergoing infertility treatment took surveys looking at their sexual satisfaction and quality of life. The study showed that the longer the couple had suffered with infertility, or the more fertility treatments that had failed, the higher likelihood they would suffer from lower self-esteem and have dissatisfaction with their relationship and their sex life. Another study with almost 400 couples going through infertility was looking at many aspects and quality of life that were impacted by infertility and its treatment, and sexual dissatisfaction was one of the most commonly reported issues between couples. The last study I'm going to talk about is my favorite. It's from Stanford, and it was a survey that was done comparing women who were undergoing fertility treatment to a control group of women that were not infertile, looking at quality of life and sexual satisfaction. And 40% of the women undergoing fertility treatment reported issues with their intimacy and sexual satisfaction, which was double compared to women who were not undergoing fertility treatment. I love this study because I love the people that did this study. They did it when I was in fellowship, and I remember them talking about what an important study this was. This was years ago, and people were just not talking about it. But as fertility doctors, we know that this is a common issue. So we know, and the research shows, that infertility, especially the longer it goes on, can impact sex life and intimacy between a couple. But why? Why does this happen? I mean, isn't this supposed to be the fun part? If you share with friends and family that you're trying, sometimes people will get uncomfortable and make little jokes about like, oh, maybe you're not doing it right, or maybe you need to do it more often, or just go on vacation, just relax, or, isn't that supposed to be the fun part? And the longer this goes on, the less fun it feels like. So I think of four main categories or reasons why intimacy is so impacted with infertility. And number one, sex becomes more like a job. Intimacy is gone, and this act of intercourse is more just like, I gotta do this in order to reach my goal of having a baby. And this can impact both partners, and it can impact every aspect of life. So the female partner can be really paying attention to ovulation and worrying about timing. The male partner can be thinking about like, how often can I produce a specimen so I have like the ideal specimen on the day that she's ovulating. People think about travel and worry about being apart from each other during that week of ovulation, because you're the most fertile about 6 days leading up to ovulation. That's your fertile window and when you should try. I have a whole video on baby making sex tips, and timing of ovulation is another great video. I have lots of ways to help if you're trying to figure out when to try to conceive. And these tips are helpful, but the more months that you do them, the more it just starts to be like a job. And that can be the case for both couples. The second thing I think about is men will talk about, a lot of the research that I read, and my own patients have shared this with me, that they start to feel more just like a sperm production tool rather than a person. They feel like their partner is kind of disconnecting a little bit and just really focused on timing and sort of, we got to do this at this time. And the male partner can just sort of feel like he's just there kind of for one reason, and that's a real lack of intimacy. So that is common. Number 3, I read about this and it makes sense to me and it just breaks my heart, but it's true. A lot of people with a history of sexual trauma will have a lot of difficulty with trying to conceive because especially the fertility evaluations or fertility treatments involve a lot of procedures or ultrasounds or, speculum exams and things like that. And people with a history of sexual trauma, especially women, can often disconnect from their body when exams are happening or treatments are happening. And that disconnect, the more months that this goes on, that can happen with intimacy at home. And so that is heartbreaking, but it's true and it makes sense to me. And if this resonates with you, you are not alone. And I have some tips in just a few minutes about how you can get help. And then number 4, and this goes for both partners, sex just becomes a reminder of what you don't have. So it's more like a job, and it can remind you of the fact that you don't have a baby yet. There's so much shame and so much misunderstanding around fertility, especially if one partner feels like it's their fault, whether it's the woman, because that's really very common, anything the family building, it's got to be the woman's fault. Or maybe you guys have gotten some testing and the male partner realizes that he's got a low sperm count. And so especially if someone's carrying around guilt or shame as, oh, this is my fault, then just trying each month can be a reminder of that. There are so many reasons why intimacy can be lost the longer and longer fertility goes on. And so if this is happening to you, you are not alone. And here are some thoughts and helpful tips to help bring intimacy back to your relationship. Number 1, don't ignore the issue. Do not put off the discussion around intimacy until the treatments are successful or until you have a baby. This is something that's happening now. And quite honestly, infertility can sometimes be more like a marathon and less like a sprint. And so if you're just kicking the can down the road and you're just not talking about it, the longer and longer it goes on, the more and more difficult the conversation is to have. And this is all about communication. Your partner may be feeling the exact same way, and just sharing that you both feel this way can be the start of communicating on how to make things better. Number 2, make sex for a baby different from intimacy. So there's many different ways to do this, but if when you're ovulating, just kind of communicate with your partner like, okay, we need to get this done, but make sure that you have other times in your cycle where you can be intimate, whatever is right for you. One thing that you can think about is actually having separate, rooms, separate places where baby making sex is kind of like, this is a job and this is what we got to do. And this is where we do that. But, other intimacy things happen elsewhere. So if you have another room in your house, maybe the baby making sex can be in that room, but then being intimate happens in your bedroom. So sometimes just that mental part about separating these two things and just acknowledging that it is different can be very helpful. So the times where you can connect as a couple can be away from or in different rooms or with different feelings and just kind of mentally separate those two things. One of the reasons this is helpful is that sometimes if we're not communicating very well and one partner is like trying to make intimacy more spontaneous, the other partner can be, worried like, oh, are we just doing this now because you might be ovulating, right? So if it's sort of communicating and you're like, okay, this time of the cycle, like we're doing this way, and other times when you really are trying and you want to be intimate, a little bit of that spontaneity can come back. Number 3, focus on your relationship outside of the physical. So spending time together, doing something you enjoy, finding a new hobby, whether it's cooking a meal together, going hiking. If you used to do something in the beginning of your relationship together that you absolutely enjoy, but you don't do that anymore, make time for that. Whether it's, I don't know why I just thought of it's like canoeing, or again, going for a hike, or a cooking class, or seeing a new movie together, date nights, just something to reconnect and find that intimacy that is not related to being physical is really important. Number 4, see a professional. It could be a sex therapist. It could be a couples family therapist. If someone in the couple is really having some memories or dealing with sexual trauma, and this is kind of bringing this up, finding that expert help to really talk about what is going on and what triggers are happening and ways to connect with your partner. Seek professional help, because this is so common and there are people out there to truly help you. Number 5, there's a wonderful book out there. It's called Conceiving with Love by Denise Weisner. And this book is all about just how common intimacy issues are with infertility. Some really helpful and in-depth guidelines on reconnecting with your partner. So that book is an excellent resource. So let's recap. Infertility can absolutely impact intimacy. If you are feeling this way, you are not alone. The research absolutely shows that this happens. The reasons why are multifactorial, but it can be because sex starts to feel like a job and less about intimacy. People can feel differently about this process. It can bring up a history of sexual trauma and some issues that people have had from the past. And it can just be a reminder of what you don't have. So this impact on your sex life is so common. And so recognizing that and realizing that you're not alone is the first step. When you're ready to seek help for this or to work on this with your partner, number 1, don't put it off. Start talking about it now. Number 2, try to make baby making sex very different from intimacy. Number 3, try to reconnect with your partner outside of being physical. Number 4, ask for help. There are professionals out there that can help with relationships, whether it's a sex therapist or just a family therapist, just finding that help if you need it. And number 5, that book, Conceiving with Love by Denise Weisner, is a wonderful resource. I hope this video was helpful. This is such a common issue, and I really want to address it. Like this video if you learned something, comment with questions that you have, subscribe to this channel, and stick around for more learning.